Hello, my name is Asante Quintana, a third-year medical student at Meharry Medical College in Nashville, Tennessee, and I, with the help of my colleagues Britt Hatcher and Tyler Pfister, under the guidance of Dr. Lindsey and Dr. Padovani-Claudio at Vanderbilt University School of Medicine, will be presenting our research titled The Socioeconomic and Clinical Determinants of Cataract Surgery Incidence and Outcomes Among VUMC Patients. To begin, let's take a step back and talk about cataracts. As you see here in this graphic, cataracts are the most frequent cause of age-related vision loss in the world. Right here, we have a healthy eye with a clear lens. However, as you age, this lens can become clouded by cataract, ultimately forming symptoms including blurred or hazy vision, reduced color intensity, increased glare, decreased night vision, and rapid changes in prescription glasses. Prior research has revealed that minorities have lower rates of cataract extractions than whites, and because racial inequalities in the management of cataracts may disproportionately burden the quality of life for minorities, we wanted to assess this in our network. We did this assessment with a preliminary retrospective cohort study using Vanderbilt's de-identified electronic health record database, the synthetic derivative, identifying patients with senile cataract and those that underwent surgery using FIWAS and CPT codes, and we evaluated significance using a chi-square test. Moving on to our results, we take a look at a graph which outlines our analysis of racial distribution for Caucasians, African Americans, Asians, Hispanics, and other races. In this blue, it's the overall population for the synthetic derivative. The light blue represents the population for the senile cataract patients, and the black represents the population of those senile cataract patients that underwent cataract surgery. The y-axis represents the percent of individuals of each race within each cohort. Let's take a look at Caucasians. We see Caucasians made up 60% of the synthetic derivative. However, they had a higher than expected rate within the senile cataract group at 79% and even higher than expected rate for the cataract surgery group at 82%. We see similar higher than expected rates within the senile cataract group for African Americans and Asians, but lower than expected rates for cataract surgery at 9% and 1%, ultimately suggesting racial disparities within the management of cataract extractions. It is worth noting that Hispanics and other races did not have a difference within the senile cataract and cataract surgery groups. We then went on to examine the rate of cataract extraction by race. This graph analyzes the percent of patients within a race with cataracts ultimately undergoing cataract extraction. You can see the overall cataract extraction rate for everyone was 50%. However, Caucasians had a higher rate at 52%, with African Americans, Asians, and Hispanics being lower at 40%, 40%, and 44%. We then found that by using a chi-square test, the data suggests that the observed variance in cataract extraction rates by race is significant. We concluded that within Vanderbilt's network, cataract extraction rates are lower for racial minorities than whites, with the trend being most pronounced among African Americans and Asians at 40% and 40% respectively. It is also worth noting that historically, women have higher rates of cataracts than men, which was also observed within this population. Our next steps will be using this platform to identify factors including socioeconomic or clinical factors that may affect the observed relationship between cataract extraction rates and race. We also hope to further understand why Vanderbilt's cataract trends are consistent with healthcare disparities across America. Ultimately, we find that our study validates this platform as a useful mechanism to look at the other disparities via socioeconomic or clinical factors to help close this gap of racial disparities to provide better care for all of our patients. These are our references, and thank you for watching this presentation.